My name is Dr Chibby Orjiekwe, and I'm a GP in Rainhill for about 22 years. I'm the clinical director for St. Helens South Primary Care Network. This covers 85,000 patients and 10 practices. And believe you me, I'm absolutely incensed and disappointed with my colleagues. Why is there this endless bombardment of physician associates? It's like fighting somebody in a ring who has no gloves. It's like suppressing somebody. It reminds me of things that happened in our past that I wish not to talk about today. But why is there this problem? The key question is, do we need physician associates? The honest answer to that is absolutely yes. Our healthcare system does not have the capacity to support patients barely by just using doctors and nurses. We have to think outside the box. We do need that extra capacity. I think they realized this a long time ago in the United States of America. Yes, the one that we always copy and support. And in the early 60s, it came to light that they needed to do something about it. Guess who stepped up to the mark? A doctor. Recognizing the state of the healthcare at that time, he used the expertise of medical corps practitioners who worked alongside doctors at the time and developed them. Yes, developed them into physician associates. I think that's an exemplary thing to do. And then up came the American Association of Physician Associates, a well-established body, 178,000 members strong, supporting health services and healthcare in the United States. Let us then roll forward the clock into year 2000 and above. It then started to trickle into the UK that we did need physician associates. And it was not until 2019 that a landmark study was published which showed categorically that physician associates could perform well as general practitioners in same-day appointments under supervision. And I have to emphasize that point, under supervision. And this is going to be the recurring theme of this talk. Again, guess who supported this project? One of the members of that project was an eminent general practitioner called Simon de Lusignan, a professor of primary care and medical informatics. These are doctors shining the beacon for the NHS. This is where we need to be, guys. Not having infights, not subjugating and making a caricature of professionals who have not done you any harm. This was a landmark study. And this is one of many studies that has proven that they are impactful in our day-to-day care for patients. So bear that in mind. They're not taking your jobs, guys. Seriously. Physician associates are absolutely not taking your jobs. Just health service is ailing. We've got our workforce plan. As good as it sounds and seems, I'm really unsure as to whether we have actually strategized the actual numbers that are needed to support health and well-being, given that we've used historical numbers from baseline from 2022. I suppose what we should be doing, although onerous, is maybe creating mathematical models to understand where health services need to be deployed properly. That's what we need to do. I've seen bottlenecks in the NHS. I've experienced it personally. It's not pleasant, but it happens, and that's because we haven't got our act together. We are losing doctors by the minute to Canada, the United States, nothing to do with physician associates. Before the pandemic, I and other GPs who can back me up tried to employ doctors in my practice because we needed them. I had to go to an agency to pay a finder's fee, an exorbitant finder's fee to get a doctor. Despicable, isn't it? Nothing to do with PAs. These things happen. We have to get our facts right and our act together. Now, I briefly mentioned that I was a CD in a primary care network. I am still. And we understood the problem. We started to employ additional roles and started to hemorrhage them as well. And we had to find a reason to stop that. I undertook an advanced diploma in primary care management, and through working a project, we were able to implement a strategy to proactively supervise our additional roles, make them more included, be more compassionate to them. And it's actually flourished since. In St. Helens as well, we recognize that the key problem is not knowing who you're seeing, because the primary care system is, care provision is diverse. So we introduced a strategy called 12 EPIC goals, and it was there to actually make people, the public, clear that there are quite a few people working in primary care. I've also done an audit, or survey rather, alongside one of our PAs, and the patient satisfaction is absolutely brilliant. Remember, the PAs in my organization are completely supervised. That is the strategy we have to go through. Supervision, 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 not castigation. We do need exemplary sites out there to shine the light for these people. Thank you.